A lot of patients come into my practice asking these days about vaginal rejuvenation now that this is more of a hot topic and more people are speaking openly about it. Vaginal rejuvenation can sometimes mean addressing excessively long inner labia with something like a labiaplasty or the outer labia, so just the physical aspects of the vagina. But the other part that we often treat is the internal part with laser treatments. So patients come to me and say, hey, I jump up and down on trampoline with my kids and a little bit of pee comes out. Is there anything you can do about that that's not very invasive? Or we can also treat, dryness and painful intercourse with laser treatment internally. So in my office we use FemTouch, which is a CO2-based laser, and the advantage of that is it's a fairly quick treatment. It usually takes 2 to 3 treatments over the course of several weeks. 99.9% of my patients notice a very, very distinct change even after the first treatment. It's really, really rewarding. So people who come in to talk to me about this come from a lot of different angles. So for example, it can be childbirth related or just hormonal changes with age. It also seems to help decrease the number of urinary tract infections by increasing just thickness and vascularity in that area. We're excited to be able to offer this technology in my practice. Patient satisfaction is off the charts with this.